Try to brush your gums a little bit gently.
It's a ritual that's been repeated for generations. Toothbrushing 101.
Put the bristles on part of the gums too, okay?
For every one of these children getting the best possible oral health care, there are so many children who suffer from neglected teeth.
You can't learn, you can't eat, you just can't thrive the way you're supposed to if you're a little child with oral disease.
It's also very expensive. By some recent estimates, the average lifetime cost of treating the consequences of one cavity adds up to more than $3,600.
If you can prevent that one cavity and all the rest of them, you can save millions, probably billions, in health expenditures.
Prevention starts here at the School of Dental Medicine's Frontier Center, supported by the Delta Dental of Colorado Foundation.
The Delta Dental of Colorado Foundation gifts have made enormous changes for us in our efforts to identify innovative programming that helps change the dynamics in our educational programs.
A tooth is a living organ.
You might ask what's so innovative about this? Students sitting through Dr. Mark Deutschman's lecture about oral health.
What causes dental cavities?
Well, here's what you probably don't realize. These are not dental students. They are medical students, future physicians. At the Anschutz Medical Campus, future physicians learn not to overlook the teeth when they look down the throat.
It's important that medical people have an understanding of the importance of oral health to overall health.
When the Frontier Center set out to fund new educational strategies, this was their goal.
To bring physicians and dentists together in the educational environment so they could learn from one another and hopefully have that affect their practices going forward.
All right, so let's do 15 first.
As part of their training, dentists also learn how to pick up on medical problems from the health histories they take and the oral examinations they perform.
You can't just do a filling and call it a day. That doesn't make you a very thoughtful or good clinician. You have to have a profound understanding of what's going on medically in order to see what's happening and how to treat what's happening dentally.
See if you can lean her back and her.
Dental students learn how to do a first-time dental exam on a baby. Now, thanks to the Frontier Center, nursing students and medical students also learn the same important lesson. As a result of the curriculum sponsored by the Frontier Center, a new generation of dentists will know everything they need to know about the teeth, but they will also know much more about the whole patient. A new generation of physicians and nurses will know everything they need to know about medicine, but they will also understand oral health.
I hear it from my colleagues all around the country, how lucky we are here in Colorado to have leaders in both the dental school and the medical school who are willing to take this cause up. You're just not going to find a dean like Dr. Kassebaum. You're not going to find a champion in a medical school like Dr. Deutschman. They are amazing people who listened to what we had to say and then learned much more about it than we knew about it and just ran with it.
But it took Delta Dental of Colorado's willingness to support exploration of a new frontier to make these programs a reality.
They're amazing partners, they're strong, they know exactly the focus they want to have, and they work very closely with us. And together we are making a difference. We're changing lives.
You're doing a great job.
These are the lives they are changing. Children who someday might have to ask, what is a cavity?
That's going to mean tremendous things for Colorado because those kids are going to be able to grow up to be the future Dr. Kassebaums and Dr. Deutschmans.
No cavities! No cavities! No cavities! No cavities!